Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Chance Dupuis from 9 Circles Community Health Centre in Winnipeg, Manitoba, as well as Ken Bristow, who is part of the CINetwork and have received care from 9 Circles. 9 Circles Community Health Centre serves their community with expertise in the care and treatment of HIV, hepatitis C, and other sexually transmitted infections while providing primary care, social support, and prevention services. We will explore the important work that they are doing as we honor December 1st, World AIDS Day, and work toward improving access to care and support and ultimately putting an end to HIV. How are the two of you doing today?
Good,
Wonderful.
great. Thanks for having us.
Thank you both for being here. Chance, I will start with you. We have been fortunate enough to feature 9 Circles in the past in an episode of Community Matters around the work during the COVID-19 pandemic. But in case anyone hasn't had the opportunity to listen to that, which please go back and listen to it, tell us a bit more about 9 Circles, where you're located, the services and programs provided, and the communities and population that you serve.
Sure. So we are 9 Circles Community Health Center. We operate on Treaty 1 territory at 705 Broadway in Winnipeg, Manitoba. So if you know where that is, it's at the corner of Broadway and Maryland. We offer wraparound care through our treatment of HIV and hepatitis C and other STDBIs. So as you said, we do a lot of things in terms of our clinical services, health promotions, services for folks living with HIV, community education, and our harm reduction program. We deliver services to those who are living in Winnipeg, the North Point Douglas area, and downtown. We also have our Manitoba HIV program, which is for all folks living with HIV in Manitoba.
Wonderful. Such good work. I'm really excited that we're featuring this topic today since it isn't one that we have discussed before. And as you mentioned, 9 Circles is one of only those 3 sites in Manitoba that holds the Manitoba HIV program, along with Health Sciences Centre and 7th Street Health Access. Can you tell our listeners a bit more about what that program actually entails?
Sure. So the Manitoba HIV program provides information, specialized care, treatment, and support to approximately the 1,500 people living with HIV across the province. So the Manitoba HIV's program's goal is to ensure that everyone who tests positive for HIV in Manitoba has the same standard of care and treatment regardless of where they live in the province. So as you said, currently the Manitoba HIV program is out of us at 9 Circles, Health Science Centre in Winnipeg, and then 7th Street Access in Brandon, Manitoba. So really, it's offering connection to those who have been diagnosed with HIV and primary care providers looking for more information on supporting patients living with HIV, or perhaps wanting to provide preventative medications such as PrEP or PEP, and is basically the first line of connection to those wanting to support others or themselves living with HIV.
That's amazing. That's such good work. Ken, I'm so excited that we have you here as well. It's one of our first episodes where we have someone with like some lived experience about what we're talking about, and also adding some more of a robust conversation to the podcast. I'd really like it if you could tell our listeners a bit about yourself and also about the CINetwork and what it does.
Well, okay. I have been living with HIV now for almost 20 years. I get my care at 9 Circles and have been getting it there for, I think it's close to 19 years now. And I got involved with the CINetwork, I think early on, and it was kind of weird. It was like, while we're having a conference and we kind of like you to be there, and it was that kind of a sort of, here's an honorarium, thank you very much for coming. But in the past few years, with some, I think, pushback on my part and on other people's parts that are our peers, we are now hired by the CINetwork, and we are actually paid a salary that's, I guess you would say is I can't think of the word right now, but it's equal to what other people would be getting. And we're more than just somebody at a conference. We help plan conferences. We help work with the whole network as to what the network itself is doing. And they are constantly looking for our feedback as to, are we doing the right thing?
That's amazing. I'm glad to hear that, you're hired on, living wage, valued for your work. That's perfect. But can you elaborate more? So as for someone who doesn't know, and I'm one of those
Yeah.
people, CINetwork actually, it does more than just conferences, or does it bring people together for this type of, like, for speaking about HIV and those realities, or like what else does it do as a whole?
Well, I would say probably one of the main things is working on the conferences that we have 2 a year. Um, and they're always geared to sort of what's going on today. And like the last one we had was about new innovations or new way, or what's missing in the system, what could be added, how do we add it, that kind of stuff. I'm not sure exactly what our spring conference is about yet, because we really haven't started planning it, but it'll be something that's pertinent to the time right now. The one thing that, and I've always been this, like, why are we hashing the same wheel? Let's talk about something new.
Mhm. Awesome. Perfect. Well, I mean, I'm sure everyone will I certainly will keep my eyes and ears open for the spring conference and make sure to share when we know what's going on. But with things that are ever evolving and changing in a world that's ever evolving and changing, it is super important to make sure that it is topical. So as we three all know, there is a lot of lived experience. There's a lot of stigma connected to HIV and other sexually transmitted infections, and this is all often also connected to other systemic barriers that people face. I'm wondering, Chance, if you can speak to any of the unique challenges that the clients sort of face as a whole, and then Ken, if you wanted to add anything after that about more specific lived experiences.
Sure. So just to start off, I think a lot of people aren't concerned about HIV because it's not at the forefront of people's minds. And that's what I appreciate so much about the CINetwork, and especially Ken's work, is that it's a collaboration between policymakers, researchers, primary care providers, and people with lived experience, because they're seeing firsthand how dated that stigma is. And, for World AIDS Day, obviously I work partially in communications, so I'm looking at all the current research. And right now there was a survey completed where, that it was 1 in 5 people still think you can acquire HIV through kissing, which a lot of us know is not true. And also the amount of people that know about U equals U, or that if someone is receiving effective treatment that they can't pass on HIV, is only about 16% right now. So we're still seeing some very dated ideals around HIV, which can be incredibly harmful. So, our Manitoba HIV stats are being released on the 29th, sorry about that. What day is it? So there's been about a 52% increase in Manitoba for folks that are newly diagnosed with HIV. So, and that has to do a lot with stigma, it's inconsistent housing and homelessness, mental health concerns. And the impacts of COVID-19 are already now increasing those barriers to accessing healthcare, and adding in that stigma along with it, it really increases those barriers. So we are seeing now an increase in HIV diagnoses in 2022.
And Ken, if you wanted to add anything that adds more to, that lens from your personal experience about what that stigma is like, or at least how it's being perceived, I think society wide, and the impact that has.
Well, I agree with everything pretty much that Chance has said. I think the one thing that we have a tendency to forget about, or maybe not think about, is the internal stigma that HIV causes with people. I met someone a few weeks ago who within a few years of being out of high school kind of thing, and was very concerned that if he caught HIV, he was going to die in 6 months, because that's what he knew. And so, and then even for myself, when I was, it's funny, I was talking with Mike Payne the other day, and it made me think back to when I was diagnosed with HIV and what I was feeling inside, and never really realized, I don't think at that time, that it was stigma I was putting on myself, but now I do. And I think that's just something that we're missing. Overall, there's still a big stigma about HIV because people just don't understand, we've stopped the education or we've slowed it way down. People don't understand that, well, it's a manageable chronic illness. Yes, it is. But how manageable is it? You're putting yourself, the stigma you put on yourself, the stigma you feel, whether it is there or implied, that all has a bearing on how well you manage the illness. And for some people, it's almost too much. You need the support programs, and that's where Nine Circles really does come into place, because they do have, a lot of support programs. Unfortunately, during COVID, it was a little bit tougher, but I mean, we've got through it, hopefully, and things will slowly get back to normal.
Yeah, thank you for that. I think I would assume with anything like that there comes a trauma with learning about these things and your life changing and how that changes. And I even like this week with some girlfriends, we're having conversations about STIs like chlamydia that are among, I would say, a younger demographic super common, and some people think
Yeah.
that it's sort of a nothing, and then some people still think that even that is devastating. And when there seems to be misinformation and confusion in terms of the knowledge about one that is, I would say, much more serious than chlamydia, I can't imagine the weight that would hold for someone experiencing that, and how frustrating it must be trying to speak with people who do not fully understand. I experienced that in different aspects of my life during different intersectionalities, and that's hard. I cannot imagine in the scope of this either.
I mean, I think it even multiplies it, because I think what we're seeing, and maybe Chance, you can clarify this, but I mean, we're seeing a tremendous amount of young people that are testing positive now, like under 30. Maybe not with high school education. They don't know. Like they have no idea, and all of a sudden they get told, "Oh, what, you're HIV positive," and it's like, I would assume, if I think if I was in that situation, I would think it would be a life-ending conversation.
Absolutely.
Yeah, especially like I love that you said that, and being within that age and demographic that we're seeing those rising rates, that people are making those assumptions that their health is going to be like how it was in the 80s and 90s, where we've done so much work and there's been so much research and so many amazing medical accomplishments that have been made that you can live a completely healthy life. And it's really funny that this question came up because I was at the Rainbow Resource Center over the weekend, and there was a sign. It was from, I think, 89, and it said, "Stigma keeps you from the center." And it was talking about internalized homophobia, but I really think that can be applied to even now with Nine Circles and for seeking HIV cares. That stigma really holds people back from, either learning more or connecting to care. And I think, Ken and the CINetwork and Nine Circles does an incredible job at trying to break down that wall for folks.
Yes.
Absolutely. And I would assume that a lot of the stigma too comes from so much misinformation around how it's contracted, but like also the queer community, and then also the fact that we don't tend to talk about sex as if it's something that's part of our lives and a normalized thing. It's still so seen as something that's taboo. So no one is searching for information because they have all of these feelings about it. But I'm excited to hear about all of the programs that aim to dismantle all of that issue. So I saw on your website that you offer a food bank. There's services called the High Five Fund, and a lived experience advisory. So I would love it if Ken, it sounded like you have some experience like actually visiting those programs or using them. So I'd love to hear about what they do and how they were helpful at all. And then Chance, if you have anything to add after.
Two out of the three, anyways. The food bank over the years has been extremely helpful, because this is going to sound terrible. Maybe you might want to edit this, but because Nine Circles Food Bank names or medical numbers aren't reported to Harvest, you're actually allowed to use one of the reporting food banks as well. Because one thing we do know with people living with HIV, that nutrition is extremely important. Food banks don't give the greatest nutrition, but when you have no money, it's better than nothing. The High Five Fund, or as it was previously known as the PHA Fund, is a great thing. It's a fund that has been going on for, I don't know how many years now, but longer than I've probably been at Nine Circles. And it's a fund strictly for people living with HIV to help cover unexpected expenses. So suddenly you have something that you just out of the blue have to pay and you can't afford it. You can apply, and if it's approved, you can get some money. The one nice thing they do is for people that are by themselves is you can get yourself a birthday present and a Christmas present through the fund, which is just cash, but I mean, it's still, at least you're getting something on those holidays. As far as the lived experience advisory committee, I have not been part of that.
Okay.
Yeah, and I mean, I can totally speak to that. I actually am the one that coordinates the LEA advisory. We are starting to back up, so I can sort of fill in the gaps there. So the LEA advisory is for folks, giving them an opportunity to tell their stories, to learn how to speak with the media, to learn how to even do things like this, where they're doing podcasts and really sharing their stories, because the most vital thing about talking about HIV is that it's not coming from people always that aren't living without HIV, because there are people that can't really speak to that experience, and to actually, have people with lived experience to do these kinds of, interviews is so vital. So we have the LEA advisory. It also informs our practices at Nine Circles, because it really is nothing about us without us from the HIV community. And we're really wanting to make sure that those voices are on the front line. And the food bank, absolutely. I was so lucky to be involved in the food bank for a while on the organizational end. Such a fantastic program, and especially because we are seeing a lot of folks that, are diagnosed with HIV, are living under the poverty line, have severe food insecurity. And this is one way that they can, really take care of their health and have those opportunities for food security. And the LEA advisory, the High Five Fund, we are starting to ask people if they would like to comment on what they have used it for, because, I love hearing, how it positively benefits people's lives. And I think other people would love to hear that too. So thanks for sharing that, Ken.
Yeah, I've actually, like I said, I've used it for a couple of things. Back when I was diagnosed, when I was applying for the compensation for Hep C, I had a $200 medical report that I had to pay. Well, living on EIA, I didn't have $200. I applied and they, yeah, no problem, and I got the money. And there's been a couple of other little things like, so in that sense, it's absolutely wonderful. Like it's not huge money. You can only access it, I think it's 3 times a year or something like that. 2? Is it 2 times?
I think so. I have to double check that.
Yeah, I mean, but the fact is the money's there, and it's a very fair way as to how the money is allocated out.
I mean, even like living below the poverty line, $200 is a lot. So
yeah.
It sounds like small peanuts, but I know firsthand that it is definitely not, and it makes such a huge difference. So that's amazing.
With what I get every month, $200 is my food budget for a month.
So with rising grocery prices,
I wouldn't have ate.
And it sounded like, so Chance, you listed off actually like a lot of wonderful aspects about all of them, but I did want to ask about any other specific successes or challenges that you've heard of, like through Nine Circles, other staff maybe, about what those programs have been able to achieve.
Definitely. I think that, sorry, you go ahead.
Go ahead.
Okay, definitely the number one has always been funding, especially for, a great example is the food bank. We're seeing a huge increase in our grocery prices. Now those nutritious items are way too expensive. So we rely on things like additional funding to help people with food security, and the High Five Fund. There's obviously an over demand. We are seeing more diagnosis in the province of Manitoba. So that demand for these programs is going to go up. And we really need that funding to kind of match where the demand is. And of course, I think, without what we've kind of said before, is that shame stopping for people from reaching out or, getting that support. We're seeing people kind of at a dire time when we wish we could like intervene a little bit earlier. So.
And did you want to add any challenges or successes that you found either from your lived experience or things that you've also heard as well?
Well, I guess my biggest challenge, believe it or not, and this goes back a bit, my care first started at Health Sciences Center. And then my doctor was retiring, so I had to figure something out. And I was looking for a GP, and as soon as a GP found out that I was positive, it was like they didn't seem to care about my general health. They wanted to know everything about HIV, and that's not what I wanted them to do. So that was a huge challenge. And then somebody said, well, why don't you just go to 9 Circles? They do everything. And it's always a challenge because 9 Circles has gone through some changes with doctors and stuff. So you get a new doctor. It's a challenge to kind of make that mesh with that new doctor because everyone has, different ideas. The big consistency though is that you're going to the same place. You're not moving your file from place to place, in that sense. And funding, of course, like Chance says, like with being on 9 Circles board and stuff, like I know it's like, God, why can't we get more money from the government? Like we need this. And it just seems like I'm not sure why it doesn't happen. Also, I think one of the biggest challenges too, and again, this comes down to money, is the cost of the medications.
Yes.
And figuring out a way that, why aren't HIV meds 100% free without a deductible or anything like they are in other provinces in Canada? Why are we different here in Manitoba?
I love that you said that. I don't think a lot of people realize that we aren't completely 100% funded for HIV medications in the province of Manitoba.
Yeah, and I mean, I'm seriously wondering, like, what am I going? I got 2 more years, and then I'm 65. Right now, my meds are paid for by EIA.
Right.
But my med bill for a month, okay, is over $2,000 a month. My HIV med is $1,500. Okay, I'm going to be living on $1,200 or $1,300 a month. Right? How do I pay for my meds?
I sincerely hate that reality. Wow, that's awful.
Yeah. I mean, there is a deductible that I'll have to pay, that there's programs to help pay that, but it could be $100+ a month that I have to pay on my deductible.
Right. Yeah, that still does not make life financially livable.
No.
That's awful. Well, we'll have to send this podcast directly to the people of Manitoba. Put this in an email. That's awful.
Mm-hmm.
Go ahead, Chance.
Oh, sorry. And the same thing with the preventative medications like pre-exposure prophylactic and post-exposure prophylactic. PrEP was just added to our pharmacare plan. It's been such a long time coming, but there's still a cost up front if you're not completely insured. So even our preventative medications need to be 100% covered. Absolutely. No hoops to jump through.
Absolutely.
Yes. Yeah. As for most things, money needs to be allocated to the right places, and things definitely need to change from a higher up in the government and then work their way down so that people with HIV can afford to live their lives. That's awful.
And I just want to throw this out there, and my numbers might be a little bit different now than from what I heard, but it was just a few years ago that to go from the system that they have right now to where making HIV meds, at least for people living with HIV, 100% free of charge, the cost to the province is only a few $1 million.
Right.
Per year.
Right.
Like it's not astronomical, hundreds of millions of dollars.
Absolutely. Yeah. No, I agree that should be something that seems like it has an easy fix. along a similar line,
Okay.
Ken did also allude to the pandemic and how difficult that was to navigate. And I know that, as I mentioned earlier, we did feature Nine Circles in the group podcast episode discussing the same day clinic that you were able to do, which was very successful. I'm wondering, Chance, if you could remind listeners about what the reality of the pandemic was like for Nine Circles, their clients, and any unique strategies, challenges, or successes that the Community Health Center had.
Sure. So I actually started out at Nine Circles in January of 2021. So we were right in the middle of it. And I started actually on the Frontline Harm Reduction program, which is now lovingly called the Pit Stop program. So I actually met a lot of people that were accessing the same day program when it started. And, it was really tough. Most people were deployed at that point. We had a lot of healthcare providers that were sent to the front lines to help address the ongoing issues with COVID-19. Even the screening was really difficult for a lot of people, especially those that were underhoused or homeless. We were really working with a bare bones amount of people, but in terms of the resiliency that came out of that, we really worked together. It was two hands talking to each other. We really worked hard at communication, and we have a really dedicated team at Nine Circles that is really committed to providing care. So through it all, we did work together as a team, but it was really difficult. And, there still are pieces of it that we're still feeling right now with, being stretched pretty thin for how high the demand is. But, and I think the same day clinic, which is now 1 to 4, Monday to Friday, the same day access, it was such an amazing thing to come out of it. And we also saw the birth of the Pit Stop program, which is anyone can access it. It provides free safer sex and safer substance use supplies. It also provides like life-preserving things like hygiene items, menstrual care items, socks, snacks, things like that. And, if COVID-19 hadn't happened, I don't think a lot of places, us included, would have gotten this creative with how can we provide the most low barrier care in a high barrier situation. So a lot of good and a lot of bad things came out of it, unfortunately.
Absolutely. I think the highlight of this podcast has been hearing about the innovation across the entire country and how so many people have, through community health centers, have managed to really face this head on through digital inequities. I interviewed one community health center here at Rexdale who they started using Discord to communicate with queer youth, and I had never thought of using an app like that for something like that. So it's great to hear how that CHCs were able to navigate something so difficult. Ken, I did want to give you a chance as well, though, because I could hear in the way that you were speaking that you had, were one of the people trying to access programs and had to try to navigate that through Nine Circles. And I just was wondering your opinion on, especially since you've been going there before Chance started being an employee. What was some of that like for you, as from your perspective?
COVID. What an interesting few years we've had. Medically, it didn't make a lot of difference because it was pretty much always a phone call, doctor's appointment. If there was something really pressing, you could still get in to see the doctor, but they were trying to do as much as they could by phone call. For me and for a couple of people that I know that I've talked to, the biggest issue was the disconnect from our friends, because a lot of people that I know and that they don't have a phone. I can't phone them and say, how are you doing? Our thing was, well, I'll meet you at Nine Circles on Wednesday around 1. And during COVID, that didn't work. And so there was that disconnect that you didn't really get to know or to see how your friends were doing or chat with them. Also, there was a few people that passed away that we just didn't, you didn't find out that they died until well after they had died. And then, of course, there was no way to say goodbye to them either because there wasn't funerals. So, I mean, that's pretty much the worst of how COVID impacted me as far as my life went, other than catching it once.
Yes. Well, I was in that boat as well, but no, thank you. Thank you so much for sharing that. Chance, I wanted to ask you before we start to wrap up this lovely episode, what needs do you see within the community and clients that Nine Circles serves that rely on investment both provincially and federally and health system decision makers to improve the health and well-being of your clients and the community overall?
For sure. I think definitely allocating funding to more harm reduction, non-judgmental healthcare services and service providers. There's such a small amount of us that are doing harm reduction work in each of our respective provinces, and especially in Manitoba. And we really need to expand the capacity of people that are already doing this work, and also fund more projects of people wanting to do this work. I also think that just getting involved on the fight against HIV stigma and not being afraid to push against dated ideals in your own community and lives. I think these dated ideals tend to happen because nobody really addresses them, like maybe in their personal lives. We're not really thinking about it anymore because, that happened in the 80s and 90s, when it's still happening today. So really like rejoining in that conversation, pushing back against that stigma that we're seeing from the 80s and 90s to now, and definitely fighting for more harm reduction services in your own community, I think is like the best way to support all the work being done.
Absolutely. Ken, was there anything else that you want to add that you think that, any person who might consider investment from your, lived experience that they might not even be considering or thinking about, that you would like them to consider investing in or having more knowledge of, or education that people do not have?
Education is my big thing.
Yeah.
For probably 10 plus years, I was doing tons of workshops throughout the city, throughout the province, doing education on HIV, telling my story about living with it. And all of a sudden they said, oh, well, we don't need to do that anymore. And there was no more funding. And now we know it because we talk to people and they don't know. I think if we brought the education back and gave people like, this is what it is, it hasn't changed in the sense that the way we treat it is way better. But I think the numbers would go down, but because I don't think people are learning about it, and because it's not in the forefront, people think, well, it's kind of like the mumps and that, it's gone away with time.
Absolutely. I want to thank you both so much for coming on and speaking to me today about this, and for having an episode on World AIDS Day. Like I said, I felt it was important. I wanted to do this in the past, and I'm really happy we got a chance to do it and have this conversation. Chance, I'll just ask you briefly, if anyone wanted to learn more about any of the programs mentioned, Nine Circles or the CINetwork, where would they go?
Sure. So we have a pretty active social media on our Twitter, Instagram, Facebook, LinkedIn, which you can get through our website at www.ninecircles.ca. If you're interested in the Manitoba HIV program in particular, so if you're like a service provider wanting to offer things like PrEP and PEP, put your location on the map that you're doing those services, and just learn more about the Manitoba HIV program, that website is www.mbhiv.ca, and of course the CINetwork. And if you want to sign up for their webinars or learn more, their website is www.CINetwork.ca.
And it's CIN, CIN.
CIN, yeah.
Yes, I will put it on the screen. It'll be showing up right now.
Great, thank you.
I thought I'd say it so I remember how to spell it. Thank you both so much for taking the time to speak with me today.
Thank you so much. Inviting me.
Thank you. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.